Okay then, hi. I know I'm a bit early. I think we've probably got as many people as are going to come in today to the meeting. There's quite a lot of people actually as well. For those of you who don't know me, my name is Dippin. I'm one of the professional support pharmacists at Pharma Plus. And welcome today to all of you. I think I can see a few new faces. So those of you who haven't been here in the past, welcome as well. Just a few ground rules. We are recording this. So please bear in mind that if you do want to say something as well, because it will be posted on our website for those people who couldn't attend. I'm going to unmute everybody. So let me see what the background is. Okay, I'm going to mute everybody because there's actually quite a lot of interference in the background. If you do want to speak, what there is actually a text box on the side somewhere on your panel. Just type in something there, and what I'll do is if you want to speak, I can unmute you, because if I unmute you now, it's going to cause a lot of interference. But anyway, that's the ground rules for today. My hope is that we will be finished off by the very latest 11:45, so I generally do keep the time, hopefully we'll be finished off by then. Now today, I've got the pleasure to talk to you about a particular topic that was requested last time round, and that was for pain relief. Now, it's quite an unfortunate title. It's not pain relief for counter staff, but it is actually pain relief therapies, and which that counter staff should be aware of. So it's a bit of an unfortunate title, and I only just spotted that now when I actually wrote it up. I'm just going to press this button. Okay, that's better. All right, can everybody give me an idea, or somebody give me an idea whether or not they can hear me, first of all? Just type yes, no. Somebody? Brilliant. Okay, thank you. I can hear somebody saying yes, or somebody said yes. Okay, so let's make a start on this. What we're going to do today, there's going to be several objectives. First of all, we're going to define what pain is. And it's a very simple definition in actual fact, but and it seems rather obvious what pain is, but you'll be surprised. It's quite a very simple definition. We're going to go over very briefly the different types of pain there are. Pain is not just pain, it's actually classified into loads of different things. I'm not going to go into the detail with you, but it's a good idea to get a general idea of which type of pain fits where. And as you'll see, there's different types of pain that you'll come across. What we'll then do is we'll then go over some of the therapies that you can use. Now that's both over the counter and on prescription. Now we're not going to concentrate too much on the prescription element, but I think you ought to be aware of the sorts of things that are available on prescription and why they're available on prescription as well. We're going to go over also the sorts of drug therapy that you can use for which type of pain. So in other words, the sorts of things that you can buy over the counter for your patients. And finally, what we're going to do is we're going to finish off with things to watch out for. So I'm going to produce a whole list of cautions and things that you, as a counter assistant, need to be aware of when dealing with Joe Public. Now, again, if anybody wants to ask any questions, please feel free to interrupt me. I will answer them as we go along. It's probably better if we do it that way. Okay, so moving swiftly on. Now, the definition of pain. Very simple, really. It's really a warning that your body is telling you that something is not quite right with it. And that really is essentially what pain is. And it sounds like a really daft definition, but really, if you think about it, that's all that pain is. Pain is actually a good thing. It's basically telling you whatever is wrong, get out of it, do something different. So if you've got your hands, for example, on a hot cooker or a hot stove, immediately what's going to happen is you're going to start to burn and you're going to start to feel pain. And that's your body's way of telling you, get your hand off that damn stove or damn cooker, whatever happens to be. There are people out there, surprisingly, very few, thank God, but there are people out there who can't feel pain. And in actual fact is a curse for them because they don't know when something is damaging them. And when you do experience pain, it's actually a really good thing because it's your body's way of telling you to move, really, and then do something different. And essentially that is what pain is. And we've all experienced it. Okay, let's move on to the next one. Now, what are the different types of pain? Now, I'm going to go over this with you in a little bit more detail. Now, most pain, so the huge varieties and classifications of pain types. Now, I'm not going to go over into each and every one with you. If you're interested in that, I can give you some references at the end if you want to do that, or you can just go onto Google and type classifications of pain, and it will produce a whole variety of different classifications for you. But what I've done is I've sort of like picked out the main ones for you. Now, most pain is what we call acute. Now, what acute means is that it's actually actual or threatened damage to the tissue. So, for example, when you touch something hot, it might not quite have damaged the skin yet. In other words, you will still feel the pain, but it hasn't quite damaged it. So that's what it means by threatened. And if, for example, it is burned, that is the actual pain. So it's two ways of thinking about it. There's threatened and there's actual pain as well. Now, generally with most pain, the pain will go away once the source is removed or healed. So, for example, if you take your hand off that hot cooker, the pain will probably go away within a few seconds. If, however, you have an unfortunate situation where you're actually burnt, then it will probably take a little bit longer for the body to heal and the pain to go away. And that really is what acute pain is. Okay, so that's the first classification. We'll call that acute pain. The second type of pain is something we'll call chronic pain. All right, and that is when the pain continues even after the injury and there is no obvious cause. And this is actually very severe, and it could impact the quality of life. The sorts of pain that you'll probably experience in the pharmacy is this one here, so the acute pain. The chronic pain is something which will generally require specialist management. You actually have specialist nurses, for example, who deal with chronic pain. It's quite a specialist area, and the drugs that are used, that we'll come across in a few minutes, are quite dangerous, and they do need to be used very, very cautiously as well. Now, the most common type of damage is to the muscle, skin, bone, or the internal organs, and that is a type of pain known as musculoskeletal. Now, there is another type of pain as well, which we'll come across as well, which is a lot worse than musculoskeletal. That's called neuropathic. I don't know how good your biology is, but bear in mind the fact that when pain is actually felt, it's the nerve endings that are actually feeling the pain, actually transmitting the pain sensation. Now, if the nerves themselves are damaged in a certain way, they can actually fire off these pain impulses at random, and they can be very, very intense. So if you're unfortunate to have nerve damage, sometimes you will experience really, really bad pain because of this as well. So bear in mind, you've got two different main types of pain. You've got musculoskeletal and neuropathic pain. Now, before I move on, does anybody want to ask any questions on this one? Just type it in. Okay, I'll take that to be no then. Alright, so I'm going to move on. If I can move this thing, bear with me. Okay, that's better. Right. Now, I'm going to go over some examples of chronic pain with you. Now, just to give you an idea of the differentiation between chronic and acute, some examples of musculoskeletal pain, back pain, something called fibromyalgia. Now that's muscle pain. And you've also got things like osteo or rheumatoid arthritis. Those are generally sorts of pain that you would feel from swelling of the joints and possible physical damage to the joints themselves. Now, remember we've got neuropathic pain, which is basically pain that's caused by the nerves themselves being damaged. Now, you've got, for example, diabetes. Patients with diabetes can have quite severe neuropathic pain, especially in the legs, is a very common idea, and even in the fingers as well, the very tips of the fingers. Shingles, for example, caused by the chickenpox, in adults, can actually cause neuropathic pain as well. It's quite an intense pain, and if you've ever had shingles, I've never had it, but if you've ever seen somebody with shingles, it's extremely painful. Now, there are other types of pains that you need to be aware of that really can't be classified as musculoskeletal neuropathic. And some examples are angina. That's basically where there's a pain in the chest caused by lack of oxygen to the heart. There's cancer, and you can fully imagine how painful that must be. I'm sure every one of you has probably known somebody who's had cancer at one time. You can probably see how bad that has actually been to them. And there's actually different types of migraines, and we're not talking about headaches here. We're talking about proper migraines as different types, as another type of chronic pain as well. So as you can see, there's a whole plethora of different types of pain that are around, and this is just a very small selection of some of them. Any questions before I move on? Oops. Sorry about that. Any questions at all? No. Okay. Right, now, what we're going to go over now is that now that you've got a fairly good idea of what pain is and different types of pains, it's probably a good time now to introduce the different sorts of therapy that are around. Now, what I've done is I've classified this, if my computer's going to start behaving itself. Sorry about this. It doesn't like me today. That's better. Okay. I felt it necessary to classify it into three different areas. Now, you've got the over-the-counter therapy, which is the one that you're probably going to be most familiar with. Now, you've got prescription only. Now, these are mild therapies. Now, don't let the word put you off. Mild doesn't necessarily mean they're not dangerous. They just mean that they're in between over-the-counter and what I call super strength. Now, for those of you who dispense in the dispensary, the super strength ones, most of them are controlled drugs as well. Now, those are the ones you'll find in the controlled drugs cabinet, and they can be very dangerous as well. So, we'll quickly go over each one, each sort of like strata in turn. So, what I'll do is I'll go over the counter therapy first. Now, there's different types of over-the-counter therapy. You've got something called the oral NSAIDs. Now, that is commonly known as the actually, I'll type it out if I can. No, I can't. Okay. Yes, I can. Here we are. Now, NSAIDs are known as non-steroidal anti-inflammatory drugs. That's what NSAIDs stands for. Now, you've got something called oral NSAIDs. Now, an example, we'll come on to some examples of that in a minute. You've got paracetamol, and that is very closely linked with NSAIDs. What you've also got is low-strength combination products of NSAIDs and paracetamol with something called opiates. So, for example, if you've seen cocodamol, if you've seen paramol, for example, those are all combination products of paracetamol and opiates. Another example could be anodine, for example, anodine extra, which is a combination, in actual fact, I think if I remember correctly, is of aspirin and caffeine, I think, and paracetamol. So there are whole different combinations of these sorts of drugs as well. There's something called topical NSAIDs. Now, these are slightly different, well, these are completely different from oral NSAIDs. Oral, as the name suggests, is that you take it by mouth. The topical actually means that you apply it on the skin. So that could be in the form of a gel, it could be in the form of a patch, for example. So that's what topical actually means. So they contain the same drug, but they're applied slightly differently. You've also got antispasmodics. Now, these are slightly different painkillers in the sense they don't actually treat the pain, they treat the spasm, which then releases the pain. So an example would be buscopan for things like irritable bowel syndrome, and a similar sort of drug for things like period pain, as an example. And you've also got heat and cold therapy. So if you looked at things like PR spray, if you've looked at heat patches and heat rubs, those sorts of things, they can also be available for pain relief as well. So you've got quite a lot on your armory of drugs for over-the-counter therapy. Now, what I'm going to go over, for those of you who dispense the pharmacy, I'm going to go over some of the prescription-only therapy as well. And these are items that are generally available on prescription only. Now, for the keen-sighted of you, you probably noticed that I said codeine and dihydrocodeine up here. in the over-the-counter therapy, and I've also got them with prescription-only therapy here. The reason is that the strength of codeine and dihydrocodeine up here is very, very low. You're looking at very minuscule amounts of codeine and dihydrocodeine up here in the over-the-counter therapy. The prescription-only therapy contains much higher strengths of codeine, dihydrocodeine, and what we call the opiates in general. So really the difference between these ones here and these ones here is the fact that they contain much higher levels of the particular drug. There are also combination products as well. Remember, there's combination products up here on the over-the-counter as well. Again, the main difference is that these particular combinations contain higher strengths of opioids. So, for example, with cocodamol up here, you're not going to be able to sell any more than 8 milligrams of cocodamol in 500 milligrams of paracetamol. Down here, the standard sort of like combination will be 30 milligrams of codeine and 500 milligrams of paracetamol. So again, higher strengths of codeine here. And you've got other sorts of NSAIDs here. Now, you've got different types of drugs as well. You've got piroxicam, you've got meloxicam, you've got a whole variety of different NSAIDs than you've got up here. So, for example, here you'll only have, mainly you only have aspirin, maybe naproxen. You might have low strengths of diclofenac, those sorts of NSAIDs up here. But here you've got a higher strengths of NSAIDs, and you've also got different types of NSAIDs as well. And finally, I'm not going to dwell upon this too much, but you've got some really unusual types of painkillers. You've got amitriptyline, gabapentin, diazepam, that all actually used for spasms and other types of pain relief. So, for example, gabapentin can be used for different types of migraine. These are a whole variety of different things. So there are other sorts of painkillers here as well. Now, when you go into the super strength ones, and those of you, again, who dispense and actually are able to look at the controlled drugs cabinet, you'll see some of the real sort of nasty ones here. So very effective painkillers, but very, very toxic if given inadequately. So you've got things like morphine at high strength, you've got buprenorphine, fentanyl, oxycodone, all the sort of nasty drugs up there as well, which are, and also other injectables as well. There are certain other injectables that are available only on prescription as a controlled drug. So really, as cancer assistants, you will generally be in this area here, and this is what I'm going to be concentrating on next. Okay, I'm going to stop there for another few minutes, or for a minute or so, if anybody wants to type anything in and ask me anything. Okay, I can't see anybody there. If anybody wants to interrupt, by all means, feel free to. Alright, now I'm going to move on to the next slide. Now, here we go again. Let's try it again, hold on. I've really got to get a new computer. Let's try it again. That's better. Okay. Now, we're going to concentrate on the over-the-counter painkillers now. Remember, we said there are several different types, and what I've done this time around is that I thought I'd try to give you some examples of painkillers that you will almost certainly come across in your daily life at the pharmacy. So, we spoke about the NSAIDs, the non-steroidal anti-inflammatory drugs. Now, as the name suggests, there's something they're called anti-inflammatory. In other words, they reduce inflammation, they reduce swelling. And that is the biggest difference between these here, aspirin, ibuprofen, naproxen, and paracetamol, because that isn't an anti-inflammatory. All it is simply a painkiller. They also do reduce fever as well, but we're talking about painkilling at the moment, so we're not talking about fever reduction. So, apart from the fact that these are anti-inflammatories, paracetamol doesn't have that anti-inflammatory action, but is also just as good, if any, probably a slightly better painkiller than these drugs here. So that's the difference between NSAIDs and paracetamol. So an example of paracetamol would be Calpol. You'll almost certainly find generic tablets and soluble tablets of paracetamol in your pharmacy as well. Now, low-strength combinations, examples here would include things like cocodamol. And remember, we said it was the 8 by 500 milligram strength. that you'll find. You might find it slightly high in something called Panadol Ultra. I think that has 12.5 or 13, I think, or something milligrams of codeine, but you're not going to find anything higher than that. Examples also include anodine, so that should be anodine extra, not just ordinary anodine. You've also got things like sulfidine as well, which is another form of cocodamol as an example. So these are just examples. Now, topical NSAIDs, remember these were the ones which you can apply onto the skin directly. Examples of things include ibuprofen gel, you've got profen gel, you've got I've used gel then. You've got things like Voltarol gel as an example. You've got Feldene gel as another example. And I think you've even got patches associated with that as well. So those are sorts of things that you generally relate yourselves as for topical non-steroidals. Now, examples which contain antispasmodics. You've got things like Feminax, and I'm sure you know what that's for. That's for period pain. You've got Buscopan, which can be used for general things like stomach pain, stomach cramps. You could use them for IBS, irritable bowel syndrome as well. And the actual drug inside Buscopan and Feminax is something called hyoscine. Alright, so that's quite a popular drug. And also, finally, you've got heat and cold therapy as well. So let's say, for example, I bang my ankle, I bang my knee, whatever, and it's swollen slightly. You probably want to put a cold pack on there just to reduce the swelling. That would also help with the pain as well. If, on the other hand, for example, I've got a bad back, something maybe like deep heat might be an idea. It just adds a little bit of the feeling of warmth and helps to distract the patient from the pain of the back as well. It doesn't cure the pain, mind you, but it just helps to distract them. So again, you've got a whole variety of different painkillers here, different types. There are one or two additional types which I haven't really gone into, and I think 6 is probably enough for you. And these are the ones that you're most likely, if not almost all the time, likely to experience these types of painkillers here. Now, let's see if I can do this without the computer messing up on me. Now, when to treat. Now, if you look in all the books and everything, if I went into every single ailment and how to treat, that will be here till Christmas. So what I've done is I've given you a general rule. If you're on the counter, this is a sort of rule that you should really be abiding by. And the general rule is only provide treatment when you know what is wrong and you are comfortable with what to recommend. If you're not comfortable with it, if you don't know what's wrong, refer it straight to the pharmacist. That's generally the sort of like advice I would give to anyone at the counter since I've worked with in the past. If you're not sure what it is, refer it. If you're not comfortable with what's going on, refer it as well. No pharmacist is going to tell you off for that. And also, remember that the pain is the body's way of saying something is unwell. So if somebody comes up to you and says, I've got a pain here, all they're really saying to you is that I'm feeling really, really unwell and I want you to help me out. So pain is a good thing. Remember, if you're not comfortable with what the patient is actually saying to you, and if you don't know what's wrong, refer it on. Now what I'm going to do is our final 2 slides. I think we're probably hitting 11:45 soon, so I think we've got another 5 minutes left. So I'm going to just whisk through the next 2 slides. I'm going to go over now some cautions now that you would want to know about if you are on the counter giving these sorts of medications over to the patient. Now, they're not exclusive. In other words, there are other things I'm sure you'll be able to think of that I might have missed out here. But these are sort of like the main ones that you would want to know about. So the cautions that I would say is if the pain is new or severe, refer it on to the pharmacist. If it's severe, I mean, I don't think you're going to say, no, I'm not going to refer it. I'm sure you will refer it. If it's particularly new as well, again, refer it. If somebody comes up and says, I've had a migraine for the first time ever, refer it on to the pharmacist because there's a possibility it could be something else. Anything related to the chest, refer it as well, even if it's new or old. It could simply be a muscle spasm in the chest, but in the more dangerous scenario, it could be angina, it could be a heart attack, something called a myocardial infarction. So in any one of these situations, refer it on to the pharmacist. Anything that involves blood loss as well. I'm sure you're not going to stand there thinking, oh, what painkiller shall I recommend because you're bleeding lots of blood. You're going to refer that straight on. And also there are other issues involved in there as well because they spill blood out in the pharmacy. There's clean-up issues. There's issues related to contamination, etc., which you really don't want to be around. So anything involving blood, refer it on. I generally tend to recommend, unless you're particularly competent, anybody under the age of 16, refer that on to the pharmacist as well. And that includes children, that includes 15, 16-year-olds, etc. Pain has not responded previously to treatment as well. So if, for example, you've tried paracetamol, there's really not much point in trying ibuprofen or naproxen or whatever happens to be. The two are very, very similar to each other. So if one thing hasn't worked, there's a very good chance the other won't work as well. And this is probably something that the pharmacist will refer on to the GP with. So if something hasn't worked in the past, there's not much point in giving something else, refer them on to the pharmacist. So any pain that has been caused by trauma, especially the head. So in other words, if I bang my head, that's probably going to require an A&E emergency appointment, or any other form of trauma. So in other words, if there's any sort of bang on the ankle which has caused severe swelling, refer them on to the pharmacist as well. Now, these two are interlinked with each other. Now, there are a number of medical conditions that you need to be aware of whereby a patient may not necessarily be able to take a painkiller. An example is, for example, if a patient has clotting problems. In other words, if their blood is too thick. So what could happen is that the blood could clot and they could actually die of an embolism or something similar to that. Aspirin, for example, and even ibuprofen and even paracetamol, if you take it long enough, can actually thin the blood. And if a patient is taking warfarin, for example, you would want to check that with the pharmacist to make sure that the medication that you're giving is going to be okay. There are also certain other patients who you want to have particular care over. For example, patients with diabetes, they tend to be on huge numbers of medicines, and actually I should even put the elderly here as well. They tend to be on huge numbers of medication. So if anybody who's really elderly or has got diabetes comes to you, check it with the pharmacist and make sure the medication that they're on is okay with what they're going to be using. Patients with cardiovascular issues, now with that what I mean is things like they've previously had a heart attack, or they've got high cholesterol, or they've got high blood pressure, something like that, check it again. For example, with ibuprofen, there's a very small chance that it can actually affect their blood pressure because it retains fluid in the body. Especially if you had a heart attack, the chances are you're probably going to be on aspirin one a day anyway. So all these sorts of things you need to be aware of. And also patients who've got asthma, as an example, so aspirin and ibuprofen in particular, in very susceptible individuals can actually precipitate an asthma attack. So really, if you're not sure, refer it, but particularly with these particular conditions, diabetes, the elderly, cardiovascular disorders, and asthmatics, refer it onto the pharmacist as well, just to make sure that the medication that they're already taking is okay with the painkillers that they're going to be using as well. Alright, I'm going to go into the next slide. This is going to be the final slide, you'll be glad to hear. Now I'm running slightly over, and I hope to be finished off in the next 3 minutes or so. Now, when you're selling painkillers, remember that some painkillers are addictive, and anything with codeine or dihydrocodeine can be addictive. So if a patient is coming up to you every single week or every single month asking you for the same thing day in, day out, just be careful, because the possibility is they could be addicted to the painkiller. And if that's the case, refer it to the pharmacist. Now remember that there's a maximum quantities rule with paracetamol and aspirin, no more than 32 at a time. If a patient wants more than that, talk to the pharmacist again. Aspirin is not suitable for anybody under the age of 16. And I think this bit here and this bit here and these ones, so these three could really be put into one. There are a number of preparations out there that contain paracetamol. Examples include certain preparations, Sudafed, Lemsip, you've got, Paramol, you've got Migraleave, you've got a whole number of different things that contain paracetamol. And paracetamol at an overdose is not very good at all. In other words, what you don't want to do is a patient, for example, to take Sudafed, sorry, let's get rid of that, to take Sudafed, for example, and then to say, okay, I've got a headache, so I'm going to take more paracetamol on top of that, because what's going to happen is they're going to take more and more paracetamol and they could end up in an overdose, which is not very pleasant, especially paracetamol. So when you're going to give out anything with paracetamol, with aspirin, with ibuprofen, any painkiller, you should really go over the maximum dose with you. You know, say something like the fact that, just bear in mind the fact that this contains paracetamol, and also remember not to take any more than 2-4 times a day, or something like that. It's quite important because you've got a load of different products, different sorts of things which contain paracetamol and painkillers. Now the final thing that we're going to go over is, which we've already discussed earlier, when you're talking to a patient, you might want to check to see whether or not there's any inflammation present. If there's inflammation present, then you're more likely to want to give something like ibuprofen. If there isn't inflammation present, then you're more likely to give something like paracetamol. That is about it for me, I'm afraid. I am run 4 minutes over, so I do apologise for that. Normally what I tend to do is I tend to give the floor now to anybody who wants to ask any questions. So I'm going to unmute everybody. So if you want to ask. If you want, also type your questions into the chat thing as well. Okay, does anybody have any questions they want to ask? Okay, I can't hear anybody. I'm not going to assume that most of the things have been asked here or been gone over. Sorry. Did somebody want to ask something?
Yes.
Okay, no. All right, let's call it a day then. If anybody wants to ask anything, I'll give you my email address. I always do. It is at pharma+ltd.co.uk. Feel free to ask me anything if you need to. Again, this is going to be recorded. It's going to be on the website, so if anybody wants to view this again, it should be on the website probably by Friday or so. So I'm going to call it quits then. Thank you again for everybody for attending. It is very much appreciated, and I look forward to seeing you again next month. We're going to be discussing dermatology next month. In other words, we're going to be discussing skin conditions, and we've got a specialist in to discuss that with you as well. So thanks again for everybody, and I will see you next month. Take care. Bye.